I'm going to begin with a story. It was the year 2007, and Nurse Brown had just had a beautiful baby girl. Baby Fiona was 8 months old when she started to develop an itchy rash on her delicate skin. Nurse Brown had cared for a patient a few days ago with shingles, a dormant version of chickenpox. Without knowing, apparently, passed it on to baby Fiona. And this could have been from playing with her, picking her up, while still having her scrubs from work. Fiona, now a teenager, still has those scars today. There's a continuous increase in occurrence of healthcare associated infections over the years. Although there's no known fact that uniforms of medical professionals are the cause of increase of healthcare associated infections. However, from direct patient contact, those uniforms can get contaminated. On this diagram, you can see on my presentation, there's a statistic that shows of the healthcare associated infections. And do you see how much it costs the United States when they occur? Can you believe it? Whopping $9.8 billion. Today, my goal is to persuade you, my audience, future community leaders, on why medical professionals should change their scrubs or cover them in public to prohibit the spread of contagious pathogens. My topics I'm going to talk to you today are clean hands for dirty scrubs. Does BBE really work? We're going to find out what is BBE and no scrubs in public. Or human nature after washing our hands. When there's no towel or paper towel, is to flash our hands or probably dry them on our clothing. So think about a nurse, going from patient to patient, doing patient care, quickly washing their hands, there's no paper towel, and drying their hands. Well, don't you think that's sanitary? I don't think so. Well, let's address some myths. First one, hand washing and hand sanitizer will prevent the spread of germs. I don't think so. Several studies have shown that pathogens are still present on nursing uniforms during their shift. This suggests that clean hands will not prevent the spread of germs. Another myth, medical professionals are required to change their scrubs when soiled or dirty. Yeah, no. There is no standardized regulations in the United States that govern how medical professions wear their scrubs. Now that I've gotten your attention, I think I did. Well, let's see if you can sustain it. Now let's talk about BBE. What is BBE? Like, I haven't heard about it, and I don't think you have also. Well, BBE stands for bare below the elbows, which means that nothing below the elbows, like my long sleeve, nothing below the elbows. And this was established in the United Kingdom by the Minister of Health, Alan Johnson, in 2007. His policy states, and he believes that with nothing below the elbow, you're able to wash your hands properly, which will decrease the chance of hospital-acquired infections. Well, in my opinion, in the United States, we don't have BBE. I don't see how BBE will affect you washing your hands because there's pathogens out there that you can still get from direct contact while still washing your hands, like MRSA. And if you look at that pie chart on MRSA, you can see that there's a 4.19% higher hospital stay with MRSA. Now, MRSA, what it is called methicillin-resistant Staphylococcus aureus, which is contagious contact bacteria. So washing my hands help, yes, but direct patient contact. So if I have a patient have MRSA, they touch my uniform, I go home grocery shopping, somebody touches my uniform or whatever, touch your face, they can get MRSA. You scratch an open wound and then you touch something that probably had MRSA on it. There you go, another person with MRSA. After learning about MRSA and how it affects our economy and hospital stays, are you convinced yet? Well, yes, I am. No scrubs in public. There is a major health concern in the United States of pathogens leaving the hospital and invading our communities. Countries like Canada, Australia, and the United Kingdom prohibit wearing hospital clothing and scrubs outside the workplace. Speaking as a medical professional for United States, I think the time is now that we have some regulations regarding to medical professional wearing their scrubs in public. Hold on one second. Look at the difference. Still clean. Well, after hearing all I have said today, raise of hand, where if you can click on your thing and raise your hand and tell me if you would vote yes if there was a regulation to prohibit medical professionals wearing their hospital clothing out in public. If it's not too much to ask, would you be willing to join me at the next town hall meeting as I address the commission on this matter and how we can start to make this change? Thank you so much. So fresh and so clean. Okay.